World around us is changing faster than ever before. Healthcare is growing and rapidly involving new pharmaceutical and other products that help us live much longer than ever before. But do we live much better and more quality life? Today, we will discuss how the body and mind connection affects our healthcare and our everyday life. Also, we will discuss how the AI and personal medicine will help the patients in the future, together with the chronic diseases and effects of the stress to the guts and skin disorders. To help unpack all these big questions, I'm thrilled to welcome Mr. Javier Aracil Corma, General Manager Adriatic Hungary from AbbVie. Hello and welcome.
Thank you very much, Marcel. I'm very happy to have the opportunity to discuss with you today.
Healthcare is changing very fast. When we go 10 years from now, what changes do you see?
I mean, it's a very broad question. I think that in the next 10 years, one thing that is definitely gonna evolve is the standards of care. And it's something that we have seen evolving in the past decades. We see that now the standard of care is evolving dramatically and people is living healthier and better lives. And this is thanks to many things, I would say. One of them is the innovation in treatments, which is something that we as an industry and AbbVie in particular, we spend a lot of time and investment there. And also is the data that is available that is also helping us move faster in this innovation journey.
You mentioned that people will live longer and better life. Is it going hand to hand?
I mean, we try to do that. No, I think that no one wants to live longer and have a deterioration or an erosion on their quality of life. And this is something that is definitely part of our mission and part of the way and the purpose we have as a company to help people live longer lives, but with a better quality of life.
Okay, let's go now to the more narrow picture. With people living longer, there will be much more neurological diseases and disorders. How we will fight with this and how will look the society of the people where average life is much longer than we are living up to now?
I mean, when it comes to degenerative disorders and neurological conditions, which is one of the areas where we focus as a company, I think that the first thing that we need to take into consideration is prevention. So the earlier we diagnose a condition, the better outcomes you're going to have. So this is one of the elements that I think it's very important that people takes it very seriously and go to the HCPs, to the doctors, to do the regular checkups. And the way that we diagnose conditions like Parkinson or Alzheimer will change in the future. I mean, there are now initial studies that showcase that there are scans of the retina that can predict if you're going to have Parkinson's disease in the next 7 years. So even before having symptoms, there is a potential window of opportunity to diagnose something that can happen in 7 years' time.
From the eye checking.
Exactly. I mean, it's in a very initial stages, so it's exploratory phases at this stage. And if it's not that, it's going to be biomarkers or any other areas that can help you prevent the treatment. And this is something that we take it very seriously because it's the first step to treat a condition. The sooner you start the treatment, the better outcomes you're going to have.
Okay, this is when we talk about people with a later age. And stress is affecting everybody, younger, older, and everybody. So yes, it affects skin and also gut and all the parts of our organism. How we will face with that problem, which is rising?
I mean, I think that the stress in the world we're living right now is something that we cannot avoid. And this is why in the future, I hope that there's going to be a much more holistic approach when it comes to conditions like the ones that you have alluded to, so atopic dermatitis or inflammatory bowel disease. We need to put hand on hand this diagnosis, these treatments, and the stress management. But the good thing is that in all these therapy areas, the treatments and the armamentarium that the doctors has to treat these conditions had evolved significantly. So if you or anyone has any of these conditions, please go to the doctor. There are now even more solutions than a decade ago, and this is something that you don't need to cope with these symptoms at this stage. You have the possibility to get rid of these symptoms, and this is something that I think it's part of the evolution of our society.
So for both states or diseases that we mentioned already, I think it's very important to come as earlier as possible to the doctors. So regular checkups and predictions are even becoming more important than before when we have all these healthcare solutions and, let's say, medicines.
Totally agree. And it's something that, I mean, it will also change a little bit the way that patients and HCPs or healthcare professionals interact. So nowadays there are many ways to connect with your doctor. I mean, I'm now living here in this region, but for instance, I have some regular checkups for my children with a Spanish HCP that is following my son, and it's via telemedicine. So it's something that now is available, that you can use it, and I encourage everyone to make the most of it. This is one element. And the other element that it's also changing dramatically is the usage or the utilization of artificial intelligence to screen the population. So there are several examples in ophthalmology or in neurology where by using images through an artificial intelligence algorithm, you can quickly screen if someone requires a checkup with a doctor or not, totally fine.
Could you tell us one specific example where we use AI for the predictions or that help patients and doctors significantly?
It's true that we, as a company, we use AI for several activities. I mean, one of them is to try to speed up the clinical trials, and it helps us triage the molecules in preclinical phase to find the best candidates that can support those patients in need. One of the elements where we see that there is an improving or an innovation in AI is when it comes to diagnosis of retinal conditions. So now there are several studies that are being tested in order to use machine learning and artificial intelligence to triage and diagnose retinal conditions like diabetic retinopathy or wet AMD. So the way that is being used is that right now, well, in the past you need to go to the hospital and get the OCT and get the image. Now there are tests, and they are testing in some countries a different way of doing it, which is at the GP setting, you get the image, and then the image is going directly to a repository where it's being assessed through this artificial intelligence and machine learning, and gives you a diagnosis that is being obviously checked by the ophthalmologist, which is something that it can definitely make things faster, and when it comes to eye conditions, the sooner you get a diagnosis, the better.
I'm a big fan of IE, so I couldn't resist to jump on when you mentioned IE, but let's back a little bit on the patients that we discussed before. So you have let's say, in general, two types of patients. One is that, or some of them are not coming regularly on the checkups, and this is one big problem. The others are checking on internet a lot of things, and they are coming almost with a diagnosis to the doctor, to the general practitioners.
Yes.
How to balance between two of these, and how is AbbVie helping doctors or patients to get together in the best way for everybody?
Yeah, that's true. I mean, when you look into Google, I mean, you can end up with some very scary diagnoses. And it's something that we need to alert the population that, look, the important thing is to go to the doctor and get a professional diagnosis there. What we are trying to do, and part of our collaboration, is to help patients and healthcare professionals to work on disease awareness campaigns in order to triage from the noise that is in the internet what is really right and what is wrong. So my recommendation there is that please follow professional websites from scientific societies, from patient associations, from pharmaceutical companies that obviously we collaborate and we are experts in many areas, and there you can find a lot of good information and reliable information about your condition, and then just get back to this linkage to care and get back to the healthcare system.
Before you, I have a guest who is general practitioner here in Zagreb, and he said that for digitalization, he will go 2 steps backwards in order to people more come to the doctors. Not only telemedicine and mailing and everything is good, the patient also become the one who are technologically, let's say, more advanced, have tendency to communicate through the mail, which is not possible, of course.
Well, I kindly disagree with that because I think that at the end of the day, the way that we communicate as a society has changed. And unfortunately, in many healthcare systems, you just cannot go to the ACP tomorrow. I mean, there is no capacity to have a face-to-face visits with all the patients. Therefore, I strongly encourage to utilize these alternative channels. Obviously, it's not the only way, but it's a very good complement to a face-to-face interaction at the end of the day.
Especially that we don't have enough doctors in none of the fields, in none of the country.
Exactly, yeah, and this is an endemic problem of Europe at these states. So we need to find a way to go through this bottleneck.
To balance the things.
Exactly.
Yeah. So we mentioned AI. One of the things that you mentioned is that AbbVie and the other pharma companies are using it to screen the molecules who can be successful on the end. And other is maybe the way how to cope with the, that we mentioned just now, the lack of doctors. So there is a lot of talking of AI. You said that some of the things are in early stage. Now, let's talk now, because name of the podcast is Future Now. Is it just another tool? Is it already big help, or is it things to come?
I mean, it's as any innovation, there is always incremental innovation. So it's something that we are using right now and is helping us a lot. So from an internal perspective, it's helping us to deal with a lot of activities that were very manual, that now you can do it faster, allowing us to have more time to work more on our core activities as a pharmaceutical company. And secondly, it's also being used right now, as I said, to triage these molecules that are in preclinical phase in order to speed up the time to market. So in the past, it can take up to 10, 12 years, depending on the molecule or the therapy area, to bring one compound to the market. Now this could be shortened.
With AI, of course. Yeah.
With AI, exactly. But it's something that we are also in a very early stages. So we are just kind of scratching the surface of what AI can do. And this is, I think it's a fantastic journey that we will need to navigate together as a society.
You mentioned innovation. People are talking innovation. Every second word is innovation. What is innovation to you in healthcare?
I mean, innovation to us, is part of our DNA in AbbVie, and it's just to bring innovative solutions, so solutions that are currently not present, to real unmet medical needs. And this is what we do is for a living, I would say, because we try to focus on these areas where we are experts, and these are oncology, immunology, neuroscience, ophthalmology. And in these areas where we have a track record and an expertise of bringing molecules and treatments that has improved the standards of care and has improved the quality of life of many patients, this is where we think that we can have a bigger impact to patients. And within these areas, that are very big areas, we try to focus only on unmet clinical needs, complex unmet medical needs. I mean, we do not bring treatments that are minor innovations. We try to bring, and that's part of our triage on the compounds, things that really have an impact on these unmet medical needs.
Okay, we mentioned already many interesting things and who are attractive, especially to young people, and healthcare industry, and in the case of AbbVie, pharmaceutical industry is a very competitive field. And of course, you are trying to attract the talents. And what is the system and the ways that AbbVie is using? And what do you see as a culture of AbbVie that can attract such a talents?
I mean, I'm very biased because I love AbbVie, so I'm gonna give you my honest answer about this. I think that, I mean, AbbVie is a great company to work for because as part of the DNA of the company is to serve patients that are in need. I cannot think on a better purpose for a job. How do we compete in the market, and how can we attract the best talent in the world to work with us? I mean, I think that there are several elements. One is the culture that we have in AbbVie, and here it's all about cross-functional collaboration, the freedom to speak up in a psychologically safe environment, the opportunity to fail, which is also part of the innovation. So here, I mean, when we talk about innovation all the time, as you said, I mean, innovation came by taking risks, controlled risks, on areas that are unexplored. And this would come on also with the point of failing. And the important thing is that if you fail, we take it as a learning, and then we can continue moving forward. And this is something that I think it has been reflected by and endorsed by the market. As you probably know, I mean, we have been certified as a great place to work in all the different countries that are part of the Adriatic and Hungary affiliate. Also in Europe, we are one of the #1 top employee from a great place to work standpoint. And we are also a big international company, which obviously gives you the opportunity to expand yourself in many different roles. I mean, just my case, I mean, I have been living with AbbVie in 3 different countries. So in Spain, in London, in Brussels, in Paris, and now here in Adriatic and Hungary. And this is something that completely changes your way of seeing the reality, because it's something that gives you the opportunity to be exposed to complete different situations that helps you grow as a professional. So if I was young, I think that I'm still young. I know it's not, but I try to think that I'm still young. And if I was younger, I would encourage my younger me to really go as fast as I can to one of these companies and try to make an impact into patients' life. And one element that is also very important in Adriatic and Hungary, which is the affiliate that I'm responsible for, is the variety and the diversity that we have. So we are part of a region. Well, we are a region in which we have countries like Croatia, Slovenia, Hungary, Bosnia, Serbia, and working in this affiliate gives you the opportunity to be exposed to all these different realities that as a learning experience, I cannot think in a better one, to be honest, because it helps you see the same problem from a complete different angle. And this is what I think we will need in the future, these soft skills with the evolving landscape that we have as a society. This learning agility and this adaptability, I think, is going to be one of the critical elements for the future employability.
And I'm sure, as being Spanish, it's also in the Adriatic area is the sun. It is more than in the London and Brussels.
Definitely. I mean, one thing, I mean, I'm very happy to be in this part of the world, honestly. And I mean, we are also Mediterraneans because I'm from from Spain, from Valencia, originally from, and the weather, I mean, you cannot compare it with Brussels, which we love as well. Okay, I don't want to get confronted with anyone. I love London and Brussels, but
also we are waving with the hands as a Mediterranean.
Exactly, which is a very Mediterranean thing.
I spoke a little bit AbbVie in the preparation, and I see that also you are encouraging the talents and your employees to have voluntary work to get a little bit back to society. Could you tell us a little bit more about that part of the activities?
For sure. I mean, in AbbVie, one thing that we are very proud about is the Week of Possibilities, and it's also part of our way of seeing our job. I mean, there is no, from a personal standpoint, I don't think there is a better job than to work in something that serves patients in need. And in these weeks that we call Week of Possibilities in AbbVie, we have the opportunity also to give back to the communities and to the society that in every single country. So last year, there were more than 14,000 employees in 54 countries that participate in the Week of Possibilities. And here in Adriatic and Hungary, it was more than 100 people that had the opportunity to give back to their communities with voluntary works and with voluntary services to the community in the 5 countries that we're operating in.
Great. Let's stay with these nice things. Okay, we mentioned stress, which is not nice things, but it is here. We're living with that. We mentioned that pharma environment is competitive. You are working for the global company, live all around the world. And how do you coping with the stress? What is your way out and place where you go to narrow things and to make them calm?
I mean, I love my job, and that's also an important part of coping with stress. But you're right. I mean, we live in a very stressing world and stress society. And it's very important that I think we ring-fence some of our time for what is the most important part of my life, that is my family and my friends. So what I do is several things. One is I'm very strict on my family time because, I mean, they have been with me. I have 2 children and I'm married, and they have been coming with me around Europe, traveling a lot, and it's something that is very important for me to give them quality time. So I ring-fence my calendar with time for them. Secondly, I have 2 phones. This is critical. So I have one for the company and one personal. So there are times in which I say, look, I mean, unless there is a huge urgency, I'm out. And also I like to spend time on what really helped me reconnect with life, which is my family, as I said, and also the nature. So I really like to do things outdoors. I started playing golf 4 years ago during COVID. I'm still very bad, as every golf player. So that's something that also...
But you manage to hit the ball from time to time.
I'm not where I want, but I hit it. That's true. And it's also something that I share with my family. So it's a good way of spending 4 hours all together in the nature. So it's something that I like. I also try to play paddle with my wife. And I mean, we do several things.
Okay, let's back to the work. So to the end of our conversation today, share with us some things that are coming and that maybe not so many people knows about, that will improve healthcare and will be, according to your opinion, of course, big hits in the environment that you are working.
I mean, I think that we are in this area where the data that we have access to is going to be a complete revolution. And this will help us get better treatments and get them faster to the market compared with years ago. So where is going to happen? I mean, I don't know. I mean, what we are trying to do is to speed up the innovations in the areas that we work. So as I said, in neuroscience, I mean, one of the elements that we are working quite a lot right now is on migraine. I mean, migraine is not only a headache per se, so it's something that is one of the most debilitating conditions that stated by the WHO. And it's something that I think that in the future, there are going to be even better treatments for migraine. Similarly, in oncology, I mean, we're very proud about the work that we do in oncology for severe state cancers. And it's something that we and the entire healthcare ecosystem are definitely working to continue advance on those areas and bring better life expectancy and better quality of life to those patients. This is from the therapeutic areas. And apart from that, I think that we're gonna get much more awareness on how important it is to have healthy habits right now. And it's something that I strongly believe that is important. One, we're going to do our part from the disease awareness campaigns, trying to bring the best products to the market, but people need to realize that, I mean, we only have one life at the end of the day. And the way you treat yourself is something that it will completely change. So we're going to end up in a world where there are going to be people who take seriously about his mental health, about his physical habits, about the way he or she eats. And this will make a difference, because this is something that, as we were discussing before, hopefully it's not like centuries ago where the life expectancy was 50 years. Now we are, on average, I don't have the data here, but it's around 85 years. And it will go up. So we need to do our best to keep these health conditions as good as we can.
Okay, thank you. We will finish with these nice thoughts that you said. Thank you very much for this conversation.
My pleasure. Thank you very much.
Okay, you follow us on Facebook and other social networks, and we will have another edition in 14 days.